Is it that darn thyroid that's causing you problems? You just don't know. Dr. Darren Scott is here with Chronic Care, and he's here to help us figure out what our problem is with our thyroid, because it could be our thyroid.
Correct.
What would be an example of me thinking, okay, I have an issue with my thyroid?
Yeah, some of the common symptoms is the classic ones: weight gain, fatigue, your hair will fall out, you can be depressed, depression's a big one, can't sleep. But the big ones like weight gain and fatigue, you have that, there could be a thyroid problem.
Dr. Scott, does this affect women more than men, or both equally?
Yeah, actually, because that's one of the first things we want to talk about is, you need to find out why your thyroid isn't working. And 80% of the time, it's actually not even the thyroid. It's a condition called Hashimoto's disease, and it's autoimmune. And vast majority of the patients that are autoimmune, whether it's Hashimoto's or MS, women. A lot of them most of them are women. So yeah, a lot of women will be affected by this for sure.
If it's not working, what can we then do about it?
Well, that's the key, is first you got to find out why, because that's really going to determine what you're going to do. There's 6 basic patterns that can cause you to have thyroid symptoms, right? There's more than that, but basically 6. One of them is Hashimoto's, which is vast majority, 80%. The other one is it's strictly just a thyroid problem. You take the medication, your life changes forever, and that's exactly what you need.
What I didn't realize is those two things are different.
Correct, yeah. So usually when you're going to get your blood checked, because we have a lot of patients that go in, the first question I ask them is, do you know why you're having the symptoms? And almost always they can say no. And a lot of them are on medications, right? They're changing their blood work, and it's a necessary thing, right? But they're still having all these symptoms. That means there's still something else that needs to be taken care of. And usually traditional medicine, standard practice is the medicate, the hormone, and that's it. And that's what they're checking for normally in the blood work. Is just, do you need thyroid hormone or not?
See, I think that's what you and I talk about. When you don't feel well,
but you don't know exactly what it is.
You're like, is it my hormones? I don't think the word thyroid comes to mind, and probably not for a lot of people out there.
Yeah, and really that's another one of the patterns, is your sex hormones can affect your thyroid function.
Really?
Like we've been on here a couple of times talking about the DNA. DNA, you can have all your blood markers look great, but your DNA, you could have a defect that affects how that hormone works. So yeah, you really want to find out what the problem is, what pattern, and that's the thing is, most of my patients don't just have one pattern out of the 6. A lot of them have 3, 4, 5 of them.
Is there one most common?
Hashimoto's, yeah, for sure.
That is the most common one.
But even if you have Hashimoto's, almost all of those have other problems. They'll have other issues that we just don't have time to go into today. But the only way to know is you got to do that blood work. The standard is you pull 2 markers. But we pull 11. That's how if you want to know, really what's going on and why you have thyroid symptoms, that's one piece of the diagnostic puzzle is thyroid panel. You need a full blood panel, saliva testing, DNA. We're doing a lot of DNA on our patients and amazingly making a big difference with a lot of these people.
Why are we hearing more now, do you think, about Hashimoto's and thyroid than we ever have before? Did we just not know before?
I think there's more in our life than there was 30 years ago. Because with autoimmune conditions, it's all about triggers. Your immune system wants to kill your thyroid if you have Hashimoto's. So what happens is, the guns are pointed on the thyroid gland, but there's triggers that'll cause it to do that. Hormone shifts, that's why I think a lot of women have autoimmune conditions, because their hormones are like this every single month. Us guys, we're pretty good. But hormone shifts and food sensitivities, we're exposed to so much stuff. Our stress levels are so it's all kind of a effect.
Here's the good news, there's hope. There are testimonials on the Chronic Care of Utah website of so many people that have gone through this and come out on the other side and feel good again. And I know you have a special for our viewers right now. If this is something that you've been dealing with, that you have questions about, check out our screen and also our website. The viewer special is a $49 consultation for the first 20 callers. That's a $250 value. Look at the phone number right there on your screen, or go to ccofutah.com. Dr. Scott, thank you so much.
Thank you. Love being here.
Love having you here. And after you feel